The world has changed dramatically in 3 months since our last update in the World Economic Outlook in January. A rare disaster, a coronavirus pandemic, tragically caused the loss of a large number of human lives. As countries have implemented the quarantines and social removal practices necessary to cover the outbreak, the world has been subjected to a major crash. The magnitude and speed of the collapse in the ensuing activity is unlike anything in our lives. This is an unprecedented crisis, and there is a significant uncertainty about the impact on people's lives and livelihoods. Many things depend on the epidemiology of the virus, the effectiveness of containment measures, and the development of therapeutics and vaccines, all of which are difficult to predict. In addition, many countries now face multiple crises: a health crisis, a financial crisis, and a collapse in commodity prices that interact at complex prices. Policymakers provide unprecedented support to households, firms, and financial markets, and while this is crucial for a strong recovery, there is considerable uncertainty about what the economic environment will look like when we get out of this lockdown. Under the assumption that epidemics and necessary limitations peak for the second quarter in most countries in the world and decline in the second half of this year, we anticipate global growth to fall to -3% in 2020 in the April World Economic Outlook. This is a 6.3-point decrease compared to January 2020, which is a major overhaul in a very short time. This makes the big lockdown the worst recession since the Great Depression and is much worse than the global financial crisis. Assuming that the pandemic disappeared in the second half of 2020 and that policy actions around the world were effective in preventing widespread firm bankruptcies, extended job losses, and system-wide financial pressures, we estimate that global growth will increase to 5.8% in 2021. This improvement in 2021 was only partial because the level of economic activity is expected to remain below the level we anticipated for 2021 before the virus hit. The cumulative loss from the pandemic crisis to global GDP in 2020 and 21 may be around $9 trillion from the sum of the Japanese and German economies. This is truly a global crisis, as no country is protected. Countries that are dependent on tourism, travel, accommodation, and entertainment areas for growth have especially major disruptions. Emerging markets and emerging economies face additional challenges with an unprecedented reversal in capital flows and a more limited financial space to cope with and support weaker health systems and support. In addition, some economies entered a fragile state with stagnant growth and high debt levels. For the first time since the Great Depression, both developed economies and emerging markets and emerging economies have been stagnant. For this year, -6.1% growth is expected in developed economies. Emerging economies with normal growth levels well above the developing market and developed economies are expected to have negative growth rates of -1.2% in 2020 and -2.2% if you exclude China. It is estimated that per capita income will decrease in more than 170 countries. Both developed economies and emerging economies are expected to recover partially in 2021. Alternative negative scenarios. What I described is a basic scenario, but given the extreme uncertainty about the duration and intensity of the health crisis, we're also investigating alternative, more negative scenarios. Pandemic may not be able to retreat in the second half of this year, which may lead to longer retention, worsening financial conditions, and further deterioration of global supply chains. In such cases, global GDP will fall even further if the pandemic lasts longer this year. 3% is added in 2020, and if the pandemic continues to 2021, it may drop 8% more compared to our basic scenario next year. Exceptional policy actions. Flattening the spread of COVID-19 using deadlocks allows health systems to cope with the disease, which allows economic activity to restart. In this sense, there is no balance between saving lives and saving livelihoods. Countries should continue to generously spend on health systems, conduct extensive tests, and avoid trade restrictions on medical supplies. A global effort should ensure that both rich and poor nations are immediately accessible when therapies and vaccines are developed. With the economy closed, it should ensure that policymakers can meet the needs of people and complete the acute stage of the pandemic transition once. The major, timely and targeted financial, monetary, and financial policies that have already been taken by many policymakers, including credit guarantees, liquidity facilities, credit tolerance, expanded unemployment insurance, enhanced benefits, and tax breaks, have been the lifeline of households and businesses. This support should continue throughout the limitation phase to minimize permanent scars that may result from suppressed investment and job losses in this severe decline. Policymakers should also plan to heal as restriction measures emerge. Policies should move quickly to support demand, encourage firm employment, and repair balance sheets in the private and public sector to help recovery. Coordinated financial incentives among countries with financial areas will increase the benefit for all economies. Moratoria may need to continue the recovery phase on debt repayments and debt restructuring. Multilateral cooperation is vital to the health of global recovery. Bilateral creditors and international financial institutions should provide concessional financing, grants, and debt allocation to support spending needed in developing countries. Enabling and installing swap lines between major central banks has helped to reduce international liquidity gaps and may need to be expanded to more economies. Cooperation efforts are needed to ensure that the world does not globalize, so recovery is not damaged by other losses in productivity. At the International Monetary Fund, we actively use our $1 trillion loan capacity to support vulnerable countries, including urgent financing and relief of debt service to our poorest member countries, and the same as official binary creditors. There are some hopeful signs that this health crisis will end. Countries have managed to control the virus, at least for now, using social removal practices, tests and contact tracking, and treatments and vaccines can develop earlier than expected. Meanwhile, we face tremendous uncertainty in the next step, in line with the scale and pace of the crisis. Local and international policy responses need to be deployed quickly. and recalibrated as new data emerge. The bold actions of doctors and nurses need to be matched by policymakers around the world so we can overcome this crisis together. Most of the idea, comment, information, and criticism containing in these videos have been created by Daily News Report. Before making any important investment decision, use the information contained in these videos as a starting point for conducting your own research. If you make any investment or legal decision, it is advised to consult an expert before making this decision.